from the station that's on your side. This is Channel 7 News Good Morning Arkansas.
And welcome back with Dr. Laura Wilson of Sherwood Family Medical Center here to talk about bronchiolitis and children. Good morning.
Right, good morning, good morning. Unfortunately, it's the time of year for bronchiolitis.
Yes.
And I think there's a little confusion sometimes about what bronchiolitis means. I like to explain to families, everybody knows what bronchitis is, right?
Right.
The main airway, the bronchus, it gets inflamed, that's bronchitis. Well, bronchiolitis is inflammation of the lower airways, or the bronchioles.
Oh,
right? So it's
okay.
not bronchitis, it's bronchiolitis, which again, lower airway inflammation. This is a viral illness usually caused by RSV, but there are other viruses that can do the same thing. So parents often say, oh, is it RSV? Well, truthfully, it doesn't matter if it's RSV. It can be ABC, XYZ viruses. Other viruses can do this. It's a very common illness. We usually see it in late fall, early winter. Typically, most severely affects children under 2, so especially small infants, preemies. Adults and older children can get it as well, but they typically would present more just like with a cold, so not anything too severe.
And so for other people who may not be aware of what RSV is, I mean, can you kind of explain to us what that's
Well,
about?
RSV is one of the viruses, again, that can cause bronchiolitis. So, for example, I kind of tell families, it's kind of like bronchiolitis is a soft drink. You can have Coke or Pepsi, right? RSV is a possible cause of it. And again, if it's RSV or another virus called human metapneumovirus or parainfluenza virus, it doesn't matter. The treatment is the same. You're treating the bronchiolitis, which again is the cold kind of with the wheezing.
And so as far as, so the cold, the wheezing, you know, just not feeling great.
Right, and usually this would present initially just the first day or two as a cold. And so it can be kind of tricky, especially if I'm seeing a baby in the exam room and the baby just seems like a cold. But I always caution families that on about day 2 or 3, they can develop the wheezing and the work of breathing, which is when this illness can become more severe. They can also have fever with it. It can be low grade, maybe a little bit higher. But again, the seriousness is if they develop retractions, work of breathing. And I have a little video that I was able to attach for y'all to get a view of retractions, because parents are often very worried, how am I going to know? Well, if you look at this baby here, you see how he's tugging below the ribs. Those are called subcostal retractions, or below the rib retractions. That's not normal. That baby's having to work harder to breathe. You can see he's got oxygen in place, so this baby's in the hospital. He developed enough wheezing and work of breathing that he had to go to the hospital to get oxygen.
So that's the first sign. I mean, right there, if my child's doing that, I'm going to want to go to the doctor's
So again,
office
might start with a cold, but on day 2 or 3, you might get into this stuff. And this is when baby needs to be seen for sure.
And so tell me, what's the treatment?
Unfortunately, after all these years, we're still just not that good at treating it, which is super sad. The mainstay really is just supportive care, which is Tylenol or Motrin for low-grade fever, or just fussiness, saline nose spray, nasal suction, humidifier. But if your baby develops more severe symptoms, the retractions, of course, baby needs to be seen. That might be a sign that baby needs oxygen. Or if the baby just can't take enough by mouth to stay hydrated, they may need IV fluids. So that's always the 2 things I really harp on. It's okay if your baby has RSV. If they're what we call a happy wheezer, you can treat them at home. If they have a little wheeze, but they're not retracting, they're hydrated, they're still playful, that is just a bad cold with wheezing, and it's okay to try and treat it at home. But if your baby develops any sign of respiratory distress, tugging below the ribs, between the ribs, a tracheal tug, sucking in right here, or the baby's not urinating at least 3 to 4 times per day, for sure baby needs to be seen, and that baby may need to be admitted.
And obviously, I mean, so you mentioned the age range. Could this also affect toddlers?
It can,
babies,
right. We classically think of it under 2, but I've seen 3 or 4-year-olds present with wheezing too. RSV in an older child with asthma might develop more severe wheezing too, but generally the older kids and adults, it just presents with a bad cold.
And one quick question, do I need to wait to see the retraction before I take my child to the doctor? You know, some people panic, they go right away, it's just a cold. But
yes, and of course that always is something that scares parents when we talk about wheezing and bronchiolitis. If you have a small infant and you're worried, get the baby seen. But typically, if again they're what we call a happy wheezer, they're hydrated, they're not in distress, we're probably just going to treat the symptoms. I did want to throw in there what doesn't work. A lot of times parents say, is there no antibiotic for this? Well, this is a virus, right? And so the antibiotics don't have any role in this. We used to think inhalers like albuterol, asthma type inhalers would work, steroids. The newer literature says none of it works. So again, after all these years, we really just don't have a lot to do other than supportive care to keep the baby comfortable, and again, watching for those more severe signs that might warrant admission, oxygen therapy, IV therapy, that kind of stuff.
Because there could be some other symptoms other than just the retraction that I need to be looking at.
Right.
Like the heavy wheezing.
Right. But again, if they're mildly wheezing and not in distress, I mean, I hate it, but that's kind of okay. Again, that tugging, that pulling, not normal. That's your biggest clue that something more serious is going on.
All right. Well, thank you so much for joining us this morning. Very important information, especially during this holiday season right now in the winter storm. So there is that address there, Sherwood Family Medical Center, if you want to stop by and see Dr. Wilson.